Well, hey everybody, this is Robert, and welcome to today's show. Now, as many of you may be aware, there's been a dust-up between the President of the United States, Donald Trump, and the Director General of the World Health Organization, Dr. Tedros, over the usefulness of the World Health Organization, the information we're getting from them, and whether they should continue to receive funding from the United States. And it's become quite a spectacle that's going on. And today I want to kind of look at both sides of this topic and let you decide for yourself on what side of the spectrum you may lean based on the information I have today. Let's go ahead and start out and listen to what Donald Trump had to say.
You talked a lot about the WHO, and I was wondering, Dr. Fauci had discussed them earlier, so if I could ask you a question about...
Well, he respects the WHO, and I think that's good, and he's worked with them for a long time. But they did give us some pretty bad play calling.
They've also, I think, given lots of countries in the world accurate coronavirus testing that's been central to your guys' data modeling. And so
that I don't know. I can only say that with regard to us, they're taking a lot of heat, because they didn't want the borders closed. They called it wrong. They really called, I would say, every aspect of it wrong.
So
until
the funding freeze
I'm not happy about it. Look, we fund it. Take a look. I mean, go through step by step. They said there's no big deal, there's no big problem, there's no nothing. And then ultimately, when I closed it down, they actually said that I made a mistake in closing it down, and it turned out to be right. But at the time, they did that. So we're just going to take a look at it. We fund it, and they seem to be, I said recently in social media, I said they seem to be very China-centric. That's a nice way of saying it, but they seem to be very China-centric. And they seem to err always on the side of China, and we fund it. So I want to look into it. Yes, please.
Thanks. A quick follow-up on that. So is the time to freeze funding to the WHO during a pandemic?
No, maybe not. I mean, I'm not saying I'm going to do it, but we're going to look at it.
You did say that.
We give a tremendous... No, I didn't. I said we're going to look at it. We're going to investigate it. We're going to look at it. But we will look at ending funding. Yeah. Because you know what? They called it wrong. And if you look back over the years even, they're very much... everything seems to be very biased toward China.
Okay, well, and then it was just the next day that Dr. Tedros replied indirectly to President Trump. And these are the words he had to say during a press conference. Let's take a listen.
Please don't politicize this virus. It exploits the differences you have at the national level. If you want to be exploited, and if you want to have many more body bags, then you do it. If you don't want many more body bags, then you refrain from politicizing it. My short message is, please quarantine politicizing COVID. The unity of your country will be very important to defeat this dangerous virus. Without unity, we assure you, even any country that may have a better system will be in trouble and more crisis. That's our message. Unity at national level, no politicizing, no need to use COVID to score political punches. No need. You have many other ways to prove yourselves. This is not the one to use for politics. It's like playing with fire.
All right. So what I want to do is kind of look at both sides. There are people a lot of public health officials that are pro World Health Organization, and they make some statements, particularly on we've seen several of them come out on the Sunday talk shows on April 12th. And then I want to take a look at some of the criticisms, and you can decide for yourself where you stand. But first, what does the World Health Organization do? Right? That's a very valid question. And on their website, they tell you. And it says, who works worldwide to promote health, keep the world safe, and serve the vulnerable? Our goal is to ensure that 1 billion more people have universal health coverage, to protect 1 billion more people from health emergencies, and provide a further 1 billion people with better health and well-being. So they do these different 3 major categories, and I'll go through it real quick. For universal health coverage, we focused on primary health care to improve access to quality essential services. They work towards sustainable financing and financial protection, improve access to essential medicines and health products. They train healthcare workforce and advise on labor policies, support people's participation in national health policies, and improve monitoring, data, and information. So far we haven't touched on anything that is epidemic, outbreak, pandemic related. For health emergencies, we prepare for emergencies by identifying, mitigating, and managing risk. We prevent emergencies and support development of tools necessary during outbreaks. We detect and respond to acute health emergencies, and we support delivery of essential health services in fragile settings. And lastly, for the health and well-being category, they address social determinants, promote intersectoral approaches for health, and prioritize health in all policies and healthy settings. And through our work, they say, we address human capital across the life course, non-communicable diseases prevention, mental health promotion, climate change in small island developing nations, antimicrobial resistance, and elimination and eradication of high-impact communicable diseases. So based on what I read, it does appear that a portion of the World Health Organization's job is pandemics, epidemics, and outbreaks, the prevention and so on and so forth of these outbreaks. So that was straight from the World Health Organization. And as I mentioned on the Sunday programs here in the United States, some public health professionals were being interviewed on these shows, basically saying that Trump should not defund the World Health Organization. Let's check out some of these quotes. First was former FDA Commissioner Scott Gottlieb, who was Trump's FDA Commissioner. He said, "I don't think this is a time to defund the WHO, given the fact that I think this is going to become an epidemic in the Southern Hemisphere. In parts of the world that don't have resources to deal with this kind of global issue," Gottlieb said on CBS's Face the Nation. He added, however, that Trump raised a lot of valid concerns about Chinese transparency around the COVID-19 outbreak. China was not truthful with the world at the outset of this, Gottlieb said. Had they been more truthful with the world, which would have enabled them to be more truthful with themselves, they might have actually been able to contain this entirely. And then on another Sunday show, Tom Inglesby, he's with Johns Hopkins University Center for Health Security, is also calling for the U.S. to continue supporting or continue their support for the World Health Organization. Quote, "The U.S. needs the World Health Organization to function properly," according to Inglesby on Fox News Sunday. "It is the organization that helps the world prepare and respond to this. we're going to need the world to recover from COVID if we're going to get normalcy back. So that was two of the public health experts that were on Sunday shows speaking on the side of the World Health Organization. And then there was another gentleman, his name is Navarro, and he's a spokesman with the World Health Organization, and he took some questions concerning these issues on Meet the Press Sunday morning. So let's go ahead and take a listen.
How would you assess the global cooperation right now?
I've worked before on Ebola, I've worked on influenza pandemics, and I've worked on other threats. You can only deal with these by countries working together. I'd love to see much greater cooperation between leaders. I'd like to see them united and showing the world that they believe that this global threat has to be dealt with through united action between all countries and their people. I like the fact that the World Health Organization is seen by public health professionals everywhere to be a really good direction finder. And I'm very pleased that we've been able to help different health professionals to find a way to go and a direction to find. But I would like leaders to be a little bit more cooperative. Yes, please.
Let me ask you this. Obviously, the American president, Donald Trump, our president here, does not believe the WHO has acted on the up and up, in particular when it comes to interpreting data or dealing with China. Address that critique.
Thanks very much. The World Health Organization actually works on behalf of all the governments in the world, and it operates within mandates that are given to it. And we have to rely on information that's received from different governments, and that then permits us to work out what's going on. We believe that we've had the best information coming to us that can come under the current circumstances, and that all recommendations and decisions have been made on behalf of that. But we know that there will be many things that are found to have perhaps not been done as well as they could have been done, and we're anticipating there'll be lots of examinations afterwards. Right now, we have to move forward. We have to get the best possible cooperation. I just heard you discussing with the head of the FDA some of the challenges, that things that we're learning about this virus all the time. That's why we need a strong WHO, a trusted WHO, and we hope all leaders will continue to work with us in that way.
Okay. So I want to go ahead and we've listened to and I've read some of the quotes and some of the information that say that the WHO is a necessary global health organization and that the U.S. should continue funding it without much question. But how has the WHO done with, say, some of the biggest epidemics and pandemics in the past decade? And so from this paper from a journal called Political Mistakes and Policy Failures in International Relations, this was published in 2017. It's entitled, What Went Wrong? The World Health Organization from Swine Flu to Ebola. And it says, since 2001, the World Health Organization has been actively promoting its ability to manage global health security. Recent events such as the 2009 H1N1 influenza pandemic and the 2014 Ebola outbreak have, however, led to questions being raised about the WHO's ability and extensive calls for the organization's reform. So I want to go ahead and take a look at least in this article, the swine flu 2009 H1N1 influenza pandemic. And in these aren't the first times, but the World Health Organization, over its decades of existence, has been questioned about its relevance and its performance. So let's take a look at the pandemic of 2009, the H1N1. And it says, throughout the 20th century, there was a discernible trend for naming influenza pandemics after specific countries or areas, like 1918 Spanish flu, 1957 Asian flu, and 1968 Hong Kong flu. Such practices have, however, also culminated in significant economic damage to locations associated with the disease. So in an explicit attempt to avoid the risk of the 2009 influenza pandemic would be labeled the Mexican flu because Mexico was the location where the disease first appeared, the WHO Secretariat initially settled on identifying the pandemic with the animal that is most closely associated with H1N1 virus, and that's pigs. Accordingly, for the first few weeks of the 2009 crisis, the pandemic was extensively described by WHO and international media outlets as swine flu. Now, the WHO's decision to adopt the generic identifier swine flu was arguably a noble one, intended to avoid damage to the Mexican economy. However, it did result in a raft of unintended consequences that rapidly revealed the decision was a mistake. Indeed, within weeks of the descriptor being applied, approximately 20% of the WHO's member nations implemented a series of measures that exceeded and thereby contravened international norms. In late April 2009, for example, the Egyptian government ordered the mass culling of all pigs throughout the country, estimated to be between 250,000 and 400,000 animals, as a preventative measure. Despite the fact that no human case of H1N1 had been recorded in Egypt, nor any reported outbreaks of H1N1 had occurred in pigs worldwide. Within days, the Iraqi government followed Egypt's lead and ordered the culling of 3 boars in a Baghdad zoo. Added to this, some 20 other countries, including Russia, the Philippines, Indonesia, Iran, and China, imposed trade import bans on all live pigs, pork, and pork products, citing concerns over the risk that H1N1 may be introduced into their respective human populations. Quickly recognizing the unintended consequences of the swine flu label, the WHO Secretariat launched a campaign to rebrand the pandemic Influenza A H1N1 and co-opted other intergovernmental organizations to assist in halting the various bans and related measures. Anyway, so it went on like that, and we just saw that it was just really, really horrible situation where you have the country of Egypt slaughtering the entire pig population. Just a huge, huge mistake. And then the other issues were there was the removal of the pandemic guidelines. And it says, like many disease outbreaks before it, 2009 H1N1 influenza pandemic was characterized by much uncertainty. Fortunately, due to the work undertaken post-2005 in strengthening pandemic preparedness through increased disease surveillance and collaborative arrangements, the epidemiological agent responsible for the crisis was rapidly identified as a novel strain of influenza. Importantly, however, it took a number of months after the disease's identification in April 2009 before the lethality of the virus could be accurately determined. Concern over the severity of the virus and the risk to communities was also exacerbated by international media reports, particularly in the initial weeks, until sufficient data had been gathered and interpreted. It was within this context that the WHO perpetrated a second notable mistake during the H1N1 pandemic. It removed its own pandemic influenza guidelines from the organization's website. Since 1999, the WHO had actively encouraged countries to strengthen their pandemic preparedness and had released a series of guideline documents that detail various measures designed to achieve that objective, which include like building vaccine manufacturing capacity, stockpiling antivirals, developing national emergency committees, etc. These guidelines were also important as they introduced a framework for how and when a pandemic would be declared by the intergovernmental organization, outlining the multiple stages and decision points, such as limited human-to-human transmission through to widespread, sustained community-level infection. Somewhat ironically, the WHO Secretariat had released the latest version of these pandemic influenza guidelines only a few months before the first recorded outbreak of H1N1 in Mexico. One of the crucial factors cited in the most recent version of the guidelines for declaring a pandemic, though, had been an assessment of the severity of a virus. So it went through all these different stages, and part of the problem was there was the erasure of the pandemic guidelines, presumably by a member or members of the intergovernmental organization secretariat that lacked the insight into potential consequences that would arise, understandably created additional confusion around the WHO's decision to declare H1N1 a pandemic. In the initial attempt to deflect criticism of the Secretariat's actions, rather than accept it, that it had erred in its dealings with the media and accept that its removal of the guidelines was wrong, the WHO official responded to questions about the inclusion of severity criteria in the now redacted version of the document as an error. And it goes on, and I don't want to go too much more into that, but you can always read this for yourself. It's quite a long document, and it goes over Ebola too. And speaking of Ebola, this is from a Reuters report from 2015, and it's entitled "Global Health Experts Accuse WHO of Egregious Failure on Ebola." And it says the World Health Organization's failure to sound the alarm until months into the West Africa's Ebola outbreak was an egregious failure, which added to the enormous suffering and death toll, according to global health experts. A specialist panel convened by Harvard's Global Health Institute and the London School of Hygiene and Tropical Medicine said while the epidemic engendered acts of outstanding courage and solidarity, it also caused immense human suffering, fear, and chaos, which went largely unchecked by leadership or reliable and rapid institutional responses. Reviewing the global response to the epidemic, which swept through Guinea, Sierra Leone, and Liberia, the panel said such failures should not be allowed to happen again, and major reform is urgently needed to prevent future pandemics. And I can recall back in the day when this was going on, how Doctors Without Borders, or MSF, were on the ground telling the world, especially the World Health Organization, hey, we have a major international crisis here, local West African crisis, but potentially a international crisis, and they were met by deaf ears, as I remember. Peter Pyatt, he's with the London School. He says we need to strengthen core capacities in all countries to detect, report, and respond rapidly to small outbreaks in order to prevent them from becoming large-scale emergencies. Anyway, so there was a panel that took a look at the World Health Organization, and they made 10 key reform proposals aimed at preventing such catastrophes from happening again. And among these things, it discussed handling, how to handle infectious disease outbreaks, strengthening incentives for early reporting, science-based justifications for trade and travel restrictions. Right, the World Health Organization was telling people to shut down travel, which made it very, very difficult for organizations on the ground to get the needed medical supplies when you had these travel and trade restrictions going on. It also called for the creation of a unified WHO center with clear responsibility, adequate capacity, and strong lines of accountability for outbreak response, and for a transparent, politically protected standing emergency committee to take on the responsibilities for declaring emergencies. So So here we got some very specific, harsh criticisms of the World Health Organization's actions during the H1N1 pandemic of 2009-2010, and then, of course, the West Africa Ebola outbreak of 2014-2016. And lastly, there's actually an organization out there that keeps an eye on the World Health Organization, and they've been telling the world to defund the World Health Organization because of their failures, essentially. And they're called the Consumer Choice Center. And they say the WHO needs to focus on its core priority, responding to international health crises. Western democracies are the main funders of the WHO. Taxpayers in countries like the US, Germany, and the UK should demand more transparency and accountability within the organization. Global health is too important to leave it in the hands of the current WHO. And that's from Fred Ryder. He's a health economist and the managing director of the Consumer Choice Center. And they list 5 general reasons to defund the World Health Organization. They say, 1, the WHO focuses more on fighting non-communicable diseases than identifying and containing threats to global public health, like Ebola, like COVID-19. The WHO preaches openness, but most decisions are taken behind closed doors, and journalists are regularly being removed from Framework Convention on Tobacco Control conferences of the parties. 3, the WHO actively schmoozes with dictators like Robert Mugabe and colludes with the regimes such as Vladimir Putin's Russia to keep internal power structures afloat. Western taxpayers shoulder the bill of all of this. Number 4, the WHO has sky-high travel costs. The World Health Organization spends $28,500 per staffer, or the per capita GDP of developed countries like Spain or Italy, on travel each and every year. And lastly, the WHO loves to go on luxury trips in the name of public health. And they list one example as being a trip to Seychelles for a workshop at the stunning Coral Strand Hotel. They hosted a regional African meeting on an island far away from nearly all African countries because of the Seychelles' comprehensive tobacco control laws. So, there you have it. You got people that don't want to defund the WHO. They've been doing a good job, and they're needed during the COVID crisis, like Scott Gottlieb, for example, like Tom Inglesby, both very respected scientists and administrators in their own right. And then you have just some of the actual history, recent history of the bungling of H1N1, of the disastrous acts during the West Africa Ebola outbreak. So I don't know. Where do you stand? Should the U.S. continue, and in Western countries in addition, though they're not threatening to defund them, should countries continue to fund the World Health Organization? Do they still have a purpose? Are they taking care of the business they're supposed to be taking care of? That's the question. I love to hear what you got to say. Go ahead and comment below. Like the video, subscribe to the channel. Please share this with your friends, and I'll see you next time.